You guys, welcome to our video. Yet another episode of our video of the health. Today we're going to talk about something psychological. Today we're going to talk about anxiety disorder. Have you ever experienced this? What is anxiety disorder and what can cause it, and how possibly it can get treated? Guys, welcome to our video. The channel is Future Talks. Kindly, if you have not subscribed and if you have not shared with our friends, kindly share and also keep in the channel. We have social anxiety disorder. This involves excessive fear and self-consciousness in social situations, which can interfere with the daily activities. Number 4, we have specific phobias, like this involves intense and irrational fear of specific objects or situations, such as spiders, heights, and also the flying. Those are specific phobias. Number 5, we have what we call obsessive compulsive disorder. It's a type of anxiety disorder, and this is called OCD, or obsessive compulsive disorder, OCD. This involves recurring and unwanted thoughts or obsessions, accompanied by repetitive behaviors and also compulsions. Number 6, last but not least, is what we call post-traumatic stress. In the post-traumatic stress is what we call PTSD, post-traumatic stress disorder. This can develop after traumatic events and involve symptoms such as flashbacks, nightmares, and the avoidance of trigger. So post-traumatic stress disorder, PTSD, develop after traumatic event and also involve symptoms such as flashbacks, nightmares, and also avoidance of triggers. So on the management or the treatment of anxiety disorder, it involves the combination of medication, psychotherapy, and lifestyle changes. So cognitive behavioral therapy, what you call CBT, is a type of psychotherapy that can be particularly helpful in treating the anxiety disorders. It involves identifying and changing the negative thoughts and behaviors that contribute to the anxiety. Also, the lifestyle changes they may help manage the anxiety disorder, like regular exercise, getting enough sleep, avoiding alcohol and caffeine, and practicing relaxational techniques in meditation, such as deep breathing and also the yoga. So, if you are experiencing symptoms of anxiety disorder, it is important to speak to your healthcare provider to guide you on the specific way on which you can get help, so that you get appropriate diagnosis and also appropriate management, so that you get out of this out of this condition, so that one gets to run a normal life despite the cause. So, like I mentioned, the examples of the causes, uh, uh, normally with the research and also after reading a lot of materials about this, the anxiety disorders are not understood why they come about sometimes, but they are believed to be a result of a combination of factors. And such factors can include genetics. So anxiety disorders tend to run in the family, like if you had a father or a parent or a grandfather who had the anxiety disorder, it's likely also to be seen in the family. So genetics is related to the cause of this anxiety kind of disorder. Also, what we call brain chemistry. When we talk about brain chemistry, we are talking about the neurotransmitters, which are the chemicals in the brain that regulates the mood, may be imbalanced in people with the anxiety disorder. So it can the brain chemistry can also be the cause of the anxiety disorder. And also environmental factors such as traumatic or stressful life events, such as abuse, especially in the young kids who are maybe sexually abused or physically abused by their parents or their caregivers, or people who they interacted in their childhood. So that's such kind of kids, because of that kind of environment of being abusive, this can also be betrayed later in life of this kind of kids. Also, the death of a loved one can be one of the environmental kind of cause this anxiety disorder, or natural disaster, during wars and other things where people get to experience a lot of deaths and also a lot of stress at that particular point. So such people are likely to experience the anxiety disorder at some one point in their lives. Also, even the soldiers involved in the fights, also the wars, can also experience the anxiety disorder at a certain point in their lives. So such kind of environments, we are not saying everybody can experience the anxiety disorder, but there is a high likelihood that these people will experience such kind of will experience anxiety disorder in one year or the other. Also, medical conditions, certain conditions like thyroid disorders, because thyroid also control in one way or the other controls the moods, and also the way the brain combination, and also the way one gets to think and also handle issues. So when one has thyroid disorders such as hyperthyroidism and also hypothyroidism, and also even the tumors of the thyroid, such kind of experience can also bring about the anxiety disorder. So medical conditions also can cause things like also heart diseases and also chronic pain, so may contribute to the developing of the chronic anxiety disorders. Also, we have substance abuse as the cause of the anxiety disorder. So substance abuse, particularly of drugs or alcohol, can contribute to the development of anxiety disorders. So the substance abuse is also a very great contributor to the anxiety disorder. Also, personality factors, like people with certain personality traits, such as being perfectionists or having low self-esteem, may be more prone to developing anxiety disorders once in their lives. So it is important to note that anxiety disorders are complex in a way. So from the causes I've mentioned, like the genetics, the brain chemistry, environmental factors, medical conditions, substance abuse, personality factors. So it is important that if you are experiencing anxiety symptoms or symptoms which can lead to anxiety disorder, it is important to speak with a healthcare professional who can identify the underlying cause and provide appropriate treatment, because people with this kind of conditions also may not be able to identify them on their own, but with the help of the healthcare provider, they can be able to be helped uh, through those professional healthcare providers, and especially make the appropriate diagnosis before any treatment or any management is initiated on the patient, so that we have the right diagnosis and also the right treatment for that patient or a client who needs the help from the anxiety disorder. I want to mention about the management, the basic management for these anxiety disorders. So management of anxiety disorders may involve combination of medication, psychotherapy, and lifestyle changes. And here are some of the strategies which we employ or which are employed to manage the specific anxiety disorder. So number one, medication. So normally the drugs called antidepressants or anti-anxiety medication and beta blockers are often used to treat the anxiety disorders. This medication can help to manage symptoms such as excessive worry, panic attacks, and symptoms of anxiety. So also psychotherapy, very important, is also involved. What you call cognitive behavior therapy, or CBT, is a type of psychotherapy that can be helpful in treating the anxiety disorders. So CBT involves identifying and changing the negative thoughts and the behaviors that contribute to anxiety. So through the proper diagnosis, CBT is employed to manage the anxiety disorder. Also, relaxation techniques such as I have talked about yoga, meditation, and also uh, relaxation are very important, so that this kind relaxation techniques makes the one now manage the symptoms of anxiety. They have really been seen to work through a lot of research which has been done. So this can be prescribed to a patient, the relaxation techniques, so that the patient gets to get well and also get to manage themselves. Also, very important is about lifestyle changes. Can be used also to manage anxiety disorders. So, and when we talk about lifestyle changes, exercise is one of the component which is very important. So regular exercise is very important. So exercise, as much as it helps us to lose weight, it also helps to balance the chemicals, the neurotransmitters in our brain, and also prevent us from getting to this anxiety disorder. Also, a very important component of it is also getting enough sleep as a form of lifestyle change. 6 to 8 hours of sleep, because also sleep deprivation can also lead to this kind of a problem. So, and also on lifestyle changes is about avoiding alcohol and caffeine taking, like people who drink and also take smoke cigarettes. So it is a form of management that are really advised to avoid it, so that to manage this condition very well. So as a way of management, and also with when they avoid this, they avoid like alcohol and caffeine, and also they practice the relaxation techniques. This can help manage the anxiety maybe which is developing. Another very important aspect is about support. Having a support system such as a family, friends, or a support group can help to reduce the feelings of isolation and provide emotional support, especially when one has been bereaved. The family is very important, and also support group and also friends. That's why people need to come together and also console with the one who has lost the loved one, so that one don't get to that situation of anxiety disorder. Self-help is also very important. Learning stress management techniques as an individual, because sometimes the support system may not be there, but you are there for yourself. So such as things like time management and problem solving skills can help to reduce stress and anxiety. So it is important to work with a healthcare provider to develop a management plan right for you. If you are experiencing the symptoms of anxiety disorder, speak with your healthcare professional who can help identify the underlying cause and also provide appropriate treatment as it may be needed. On how you can prevent the anxiety disorders, while there is no surefire or surefire way to prevent anxiety disorder, there are some steps that you can take to reduce your risk of managing or manage the symptoms which can be related to anxiety disorder. So these are I'm going to give you some prevention strategies which you can use to avoid anxiety disorders. Number one is manage stress. Learning effective stress management techniques such as relaxation techniques, exercise, as I've mentioned about the yoga and also meditation is very important, and also time management skills, or you know how to manage your time so that you have time to rest and also time to exercise and everything. So help you to manage the stress very well. So with the management of how to manage and manage stress strategy, so this can help to reduce the stress and also prevent the anxiety disorder. And another very important aspect on how you can manage or how you can prevent anxiety disorder is about getting enough sleep. We've talked about adequate sleep is essential for physical and mental health. So lack of sleep can contribute to feelings of anxiety and stress. And also, very important, stay active. Talked about regular exercise can help reduce stress and anxiety as well as improve overall physical and mental health. Also, limit the caffeine and alcohol. Like caffeine and alcohol can contribute the feelings of anxiety and stress. Limiting or avoiding these substances can help prevent anxiety, disorders. So seek and also very important, seek support when you find it that you are overwhelmed. Having a support system such as family, so that's why family is very important, and also trustworthy friends. Also, the support group can help reduce the feelings of isolation and also emotional support. And also, another strategy is about practice mindfulness. Mindfulness is a technique that involves being present in a moment and focusing on your thoughts and feelings without judgment. So, mindfulness can help reduce stress and improve overall mental health. Another strategy which is can be very good is also about seeking professional help. If you are experiencing symptoms of anxiety disorder, it is important to seek professional help. So a healthcare professional can provide accurate diagnosis and appropriate treatment, because we don't want to get you into a misdiagnosis. We want you to get the best help. So a healthcare provider can really help and can be handy in such kind of situations. So if anxiety disorders become unmanageable or they are not managed well at some point, they can lead to several complications. And one of those complications, which is very common, is what we call depression. So anxiety disorders can increase the risk of developing depression as the constant worry and also a stress that takes the toll of our mental health. So when depression comes in now, is a serious medical condition now which needs to be treated aggressively. So that's why it's very important to always approach it in a very controlled way. So another complication which can come about with anxiety disorder. Sorry guys, let me take some water here. Water is also a very important component in managing this anxiety disorder. So another complication which can come about is about social isolation, where one now separates themselves from others, and also it becomes that person becomes very difficult to engage in social activities. This social isolation and feelings of loneliness now becomes a big issue, where one now separates themselves totally from others. Also, as a complication, we may have sleep disturbance. People with anxiety disorder, which as a complication, they're not able to sleep. People can stay very long hours without sleep, and when we have a problem with sleep, it becomes now a problem. So once where this can lead also the body being very tired or fatigue or physical, and also bring other health physical disorders. So also we have what you call digestive problems, like anxiety can contribute to digestive problems such as what you call the IBS or irritable bowel syndrome and other gastrointestinal disorders, because also the feeding of that of an individual with anxiety disorder is affected. Maybe someone is not feeding well or not feeding the right food, so we expect a lot of problems with the systems. And IBS, or the irritable bowel syndrome, becomes another problem there. I think I will share a video on irritable bowel syndrome. There's something about it. We'll share about what it is and how it is managed, or if it is manageable. Another problem, which is a complication of anxiety disorder, is what you call cardiovascular disorder problems. Like chronic anxiety can increase the risk of heart disease such as hypertension or high blood pressure, and other problems like heart attack when it comes to a higher level. Another complication which can come about with anxiety disorder is what you call impaired immune system function. So chronic anxiety disorder can lead to that problem of anxiety disorder, so that it becomes now very complicated to manage it. So first things first, very important. Let us know to manage the anxiety disorder at early stages, because that is the best way in which we can uh, always manage them. And for those who believe in the Bible says always bring your if you are heavy laden, or if you have heavy luggage, bring it to Jesus and He's able to carry it for you. So very important, because at one point or another we get into anxiety and also get worried of tomorrow. But let us know that where God is able, or Jesus is able, or whoever you believe as your God is able to carry a burden at the end of the day. So because your support system before you get into the support group is very important on how you handle this anxiety disorder before you get into another level of it, where now even someone gets to commit even suicide. Guys, welcome to our video. The channel is Future Talks. Kindly, if you have not subscribe to us. My name is Vincent. Welcome to our next video, guys. Thank you very much, and thank you for your support.